I'm just gonna check some vision with my pen light. Do you have any problems with your vision?
Nope.
Do you wear contacts?
Yes.
Okay. Just gonna look right straight ahead and I'm just gonna check your pupils. Pupils are equal, round, and reactive. Now if you just watch my pen light, and I'm just gonna check some fields of gaze, just follow it, keep your head straight. Okay, positive for accommodation, so pupils are equal, round, reactive to light and accommodation. So her vision is intact. I'm also gonna have you read some numbers. If you can just read this for me.
3, 1, 2, 8, 5, 6.
Perfect. Okay, her vision is intact. Now I'm gonna give you 3 words to memorize, and in just a little bit I'm gonna ask you for those words back. Your words are gonna be pizza, car, and the color blue. Okay? So the next thing I'm gonna do is check your vision. I'm gonna do your hearing. I'm gonna do a whisper test. I'm gonna whisper a word over on this ear and just have you cover this ear. We'll do the same on the other side. Banana. What is the word?
Banana.
Perfect. We'll check this side.
Pineapple.
Perfect. So her hearing is intact. Okay, do you have any difficulty swallowing? Okay, let me just check your neck. So trachea is midline. There is no JVD distension. Okay, I'm gonna check some facial symmetry. Can you puff out your cheeks and smile, frown, and stick out your tongue? Okay, so facial is symmetrical and round, so that is intact. I'm gonna check some sensations. So I'm just gonna touch a part of your face. You just tell me what I'm touching, okay? Just close your eyes.
Left forehead. Right cheek. Right forehead. Left cheek.
Perfect. Okay, so her sensations are intact. Alrighty, I'm just gonna check some pulses now. Radial pulses are +2, regular rate and rhythm. They're strong. I'm gonna check the brachial. Brachial pulses are +2, strong, bilaterally, regular rate and rhythm. Okay, I'm gonna have you just lean back. We would check the femoral pulses and the popliteal pulses. Check. The dorsalis pedis pulse is +2, bilaterally, regular rate and rhythm. They're strong. I'm going to check the posterior tibial. +2, strong, bilaterally. I don't know if I get your fan flag up. But there is no edema in the legs. The temperature is warm and appropriate for ethnicity. Okay, I'm going to have you sit up now and we're going to check some breath sounds. Okay, and sit up. I'm just gonna listen to your lungs. I'm just gonna have you breathe in and out whenever I move my stethoscope. I'll have you just put your arm up in the air. Check the other side. Okay, perfect. Now I'm just going to check the back. Oh. Okay, breathe in and out. Okay, alrighty. Lungs are clear in all fields, anteriorly, posteriorly, and lateral. Okay, next I am going to check some heart sounds. Okay. So suprasternal notch to the angle of Louis. First intercostal, second intercostal. This is the aortic. Scoot back, scoot back. S1, S2 noted, no murmurs, regular rate and rhythm. Then I'm going to go to the tricuspid. I mean the pulmonic, sorry, pulmonic. S1, S2 noted. Regular rate and rhythm, no murmurs. Okay. Then I'm gonna go second, third, fourth. But this is gonna be down here. The tricuspid. S1, S2 noted, regular rate and rhythm. And I'm going over mid-clavicular line to the mitral valve. Okay. S1, S2 noted, regular rate and rhythm, no murmurs. So heart sounds sound good. Alrighty, I'm going to check your abdomen. Have you lay back? Belly sounds. Any problems with your bowels?
Nope.
No pain?
Nope.
Okay, I am just going to inspect first. So the abdomen is flat, no distension. It is warm and the color is appropriate for ethnicity. So I'm just going to auscultate some bowel sounds. Okay, normal active bowel sounds in all four quadrants. I'm just gonna palpate. Just tell me if you have any pain anywhere. No pain?
Nope.
Okay. All right, I'm just gonna check some muscle strength. Just push against my hands. And then pull back. Perfect. Check capillary refill. Okay, +2 bilaterally, less than 3 seconds for capillary refill. Muscle strength is strong. Grab my hands. Muscle strength is strong. Just gonna have you breathe normally. Perfect. And I'm gonna check the back. Just breathe normally.
I'm going to take this pen light, and it doesn't hurt or anything, it's just a light, and I'm going to shine it into your hair and just look at your scalp, okay? Do you have any problems or issues with your head or your hair?
No.
Okay. Okay, I'm just going to feel with my hands, okay? All right. And look at me straight ahead, okay? Can you smile for me? Can you frown? Blow out your cheeks, raise your eyebrows. Okay, perfect. This next thing we're gonna do, this is just a cotton ball. I'm gonna rub it across your face, okay? And when you feel that cotton ball, you can just say now or when, okay? Close your eyes. When, 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 when. Okay, perfect. Open your eyes. Now I'm going to test your eyes, okay? I'm going to look in your eyes. Any issues with your eyes?
No.
Okay, I'm going to touch you. I'm going to pull your eyelids down, okay? Okay. All right. I want you to focus on my finger, okay? And without moving your head, follow my finger, okay? Okay, perfect. I'm going to get my pen light again, and I'm going to shine this in your eyes. I know it's a little uncomfortable, but it won't take very long, okay? Okay, and if you could pick a spot out there to stare at, and I'm going to put this in front of your face, and when I tell you when, I want you to focus on that pen, okay? When. All right, perfect. And this, I'm going to take a look in your eyes, okay? I'm going to touch your forehead. Okay. Okay, looks good. Now I'm going to touch your ears. Any issues with your ear? Any pain or tenderness?
No.
Okay. Okay. Looks good. I'm going to look into your ear, okay? I'm going to pull it up and back. I'm going to do this side over here. Up and back. Okay, now what we're going to do is called a whisper test, okay? I'm going to have you cover one ear, and I'm going to whisper a word, and I want you to repeat it, okay?
Okay.
Apple. Okay, and cover your other ear.
Baseball.
Okay, that's great. Now I'm going to check your nose, okay? I'm going to touch your nose. Any pain or drainage with your nose?
No.
Okay, with my pen line, I'm just going to look up there, okay? Make sure everything's good, looks good. If you could, hold one side of your nose and breathe in and out. Any issues? Okay, and do the other side. Okay, perfect. I'm gonna touch your face on your sinuses, okay? You tell me if there's any pain or tenderness. Okay, any pain or tenderness? I'm gonna look in your mouth, okay? If you can open your mouth, I'm just looking at the inside of your cheeks and your tongue. Okay, it looks good. Can you stick out your tongue and say, ah? Okay, perfect. Now I've got to test for your gag reflex. I know it's uncomfortable, but okay, stick out. Okay, looks good. Okay, now I'm gonna go to your neck. Can you move your chin to your chest and your head back? Can you turn your side to side and shrug your shoulders? Okay, perfect. I'm going to feel your nodes, okay? I'm gonna say them out loud. Preocular, postocular, occipital, tonsillar, submanular, submental, superficial superficial cervical, deep cervical, post cervical, and if you could shrug your shoulders and lean forward, subclavicular. Okay, that's good. Now I'm gonna touch your throat, okay? Any issues with your throat or your neck? Okay. I'm gonna check your carotid artery now. I'm gonna touch the inside. Okay. other side. Okay, I'm gonna listen with my stethoscope, okay? And I'm gonna have you hold your breath. When I say when, just hold your breath, okay? Deep breath in and hold your breath. Okay, breathe normal. Okay, deep breath in and hold your breath. Okay, that's great. Okay, now I'm gonna have you lay down. I'm gonna check your apical heart rate, okay? Okay. Okay, nice heart rate. I'm gonna listen to it with my stethoscope, okay? Good heart rate at 80. Okay, now I'm gonna listen to your heart with my stethoscope, and I'm gonna do it twice with both sides of it, okay? That's just so I can hear all kinds of sounds, all right? Okay. This is your aortic, pulmonary, Erb's point, tricuspid, mitral. I'm just going to do the other side, okay? Okay, and if you could roll onto your left side. I'm going to listen to your heart on your left side. It just kind of brings your heart forward so I can hear better, okay? Okay, sounds good. If you could lay on your back, I'm going to inspect your abdomen, okay? I'm going to lift up your shirt. Is that all right? Okay, I'm just going to look to see for any abnormal curvatures or lesions, and everything looks good. I'm gonna listen to your belly, okay? Any pain or tenderness in your belly? No. I'm gonna feel around on your belly, okay? Just a light. Any pain or tenderness? No. Okay, I'm gonna do a light pressure, okay? And let me know if you feel any pain. Okay, I'm gonna press kind of deep and you tell me if you feel anything, okay? If it hurts. Nothing's good? Okay. All right, I'm gonna have you sit up. Right now I'm gonna listen to your lungs, but first I'm gonna ask you to take a deep breath, and I'm gonna put my hands on your chest right here, okay? I'm just checking to make sure it's equal. Take a deep breath in, okay? That's equal, and I'm gonna do the same thing on the back, okay? Okay, take a deep breath in. All right, since I'm back here, I'm gonna listen with my stethoscope, okay? When I press it to your back, just take a slight little deep breath. You don't have to take a big deep breath, just a normal kind of deep breath. And if I go too fast, just let me know. But every time you feel my stethoscope press down, just take a deep breath, okay? Okay, deep breath in. I'm going to do the same thing in the front, okay? Take a deep breath in. everything sounds good.